PAWS for People is a nonprofit organization committed to providing therapeutic visits to any person in the community who would benefit from interaction with a well-trained, loving pet. Lynne Robinson and Krista Rahman join me now with information, and Krista brought along, I forgot. Tucker. I like Tucker. Tucker is very well behaved. What do we think, fellas? I mean, you know, he so far.
Tucker's terrific.
So, and we got to point out that we're all wearing green.
Yes, we are.
And thank you very much for wearing green. Appreciate that.
Well, I'm glad I wear green too. Yeah, yeah. And this is the PAWS signature color.
Absolutely.
Yay. Okay. So, PAWS, what have you guys been up to, Lynn? Because, I mean, PAWS is growing, right?
We always have fun. We always have fun things to tell you.
And the two PAWS are, what have you been up to?
Besides our regular therapy visits that we do in hospitals and nursing homes and work with kids, and our PAWS for Reading, which we demonstrated one time here, our brand new program is an offshoot of PAWS for Reading. It's called Pre-K PAWS, and it's directed to 3- and 4-year-olds. So this is for pre-readers. So they might sit down on our blankets and they may pick up a book and they won't be able to read it, but they can tell a story from the pictures. They can talk to Tucker and show him, like if this were the book, show him what's going on. What we're trying to do is create the love of reading with these youngsters so that they get into the idea and have fun. So when they start picking up their reading skills, it's a real positive literacy experience. So that's one thing we're doing. It's pretty kind of fun.
Why did you decide to do that?
In all honesty, we had a call from one of our new members who said, I want to read at my child's preschool. And we went, okay, what's your child's preschool? Well, it's 3- and 4-year-olds. Well, guess what? They don't read. And we went like, ah. And then I said, well, of course, we can start them because the big push, the state, the government is pushing the early reading skills and the support of that. So why not? And we just like slid right into it and said, this fits beautifully. A child, a dog, a book doesn't have to be able to read everything there.
Right.
We just get them started. So we've created about 19 different packets of pre-reading activities that our teams use with these kids.
Yeah, because I was going to say, how do you research how to use the dogs for the different purposes? And that's a good one. Like, you know, kids love animals.
Mm-hmm. And there's a lot of research about, you know, what the connection between the child and the dog and what happens. They open up, they're much more relaxed, they're able to do more things, they're more experimental, and our teams are trained to complement that and be able to use that in the experience. That's kind of fun. Very fun. And our director of reading, Stephanie Berry, worked very, very hard with a couple of other people in our office to develop the program. So now we're in Head Start. We're at one of the church preschools, and we're actually at St. Anthony's, I think in 1st grade, working with those kids. So
that's nice. Yeah, that is good. Yeah. So let me see, who trains the dogs? Now, is that up to you, the individual owner, or is that like a PAWS certified trainer person?
Who trained you? Did somebody
and if Tucker wants to move around, that's fine. We like it when they get animated.
Basically, when people come to us, like when Krista, and Krista is an actual employee with PAWS now, but when we first met her, she was another person that decided, I have a wonderful dog, I'd really like to share the dog. And so people come with animals that are partially trained. We do the training of the people and the animal to do the therapy skills. So yes, sit down, come and stay, those kinds of things. The animals come, and the rabbits don't really have to do a whole lot of those things. But it's when they come to us, we do a whole lot more of it. How do you deal with a cranky person? How do you deal with walkers and wheelchairs and logistics and treating people with respect in their space and understanding who they are and why they are there. So we do that level of training. It's not really dog obedience. But it's much more the person and the involvement.
Right.
Are you comfy, Tucker?
Yeah, he looked. Look, I was just going to reach over and he looked over at me like,
please. There he goes.
Okay.
What do you guys think makes a dog a good PAWS dog?
Who can answer that?
I think it's just a real laid-back, easygoing, person-loving dog.
Right, right. Big or small?
It doesn't matter. It doesn't matter. We have large dogs in the program. We have very small dogs in the program, and it's just that personality that the dog just shines. You can tell it loves what it does.
So how do you and Tucker do on your visits? I'm sure very well, right? Everybody loves you guys.
We really enjoy it. We've done several programs with PAWS. We're currently visiting adults with disabilities. And each one of them has something different. Some of them just want to spend a couple minutes with Tucker. Others would spend the whole hour I'm there petting Tucker. So they just love interacting with him, and they wait for his visits, and they're very excited when we get there. We're also part of the PAWS for Reading program. He loves that because it's an hour he gets to lay on a blanket and kids come to him and read. So it's a pretty hard job,
And
that
rub his
PAWS for
stomach
Reading.
and everything, right?
It is. It's a pretty tough job for him, the PAWS for Reading program.
So what do you think of the people? I am sure they respond, especially people with disabilities and the kids. I'm sure the response you get when you come into the room or the facility, it has to be like heartwarming for you because to see them so happy.
Oh, it is, absolutely. Because, I mean, this may be the bright spot in their day. You know, you don't know what's happened prior to you getting there. And just to see them light up for the 30 minutes or the hour you're there, it's a very rewarding experience.
I can share an observation with you. Dr. Paul Rosen from AI DuPont Hospital for Children, where we have now started our program, told me at one point where he was supposed to meet me in the lobby, and he said, I knew you were there with the dog before I even saw you, because there was an excitement in the room, a really positive energy. He said everybody was looking in one direction. There were parents that were smiling, there were kids that were happy, people relaxed, and I went like, oh, they know even when we come. So we get a very, very good reception. And it doesn't matter, it does not have to be somebody who is ill or somebody with a disability. It can be the nurse who's stressed, or the doctor who's had a bad day, or the custodian who, you know, has just had it with whatever situation has happened. So we visit anyone, anybody that's interested in petting and loving on the dog and talking to a nice human, because we have nice humans also. It's part of the team. It makes it a good thing. It's part of the team.
And sometimes just getting to the person you're trying to visit can take several minutes because you're visiting with the nurse or, you know, someone else that's there for a totally different reason, but, you know, they want to stop and see the dog, so you spend time with them as well.
Now, before we get into the event, because you guys have an event coming up, you have another thing. It's psychiatric therapy, right? Is that
Yes, we do.
Wow, now that's new.
Yes. We'll keep developing programs because we have been visiting all these populations since the very beginning, which is not quite 9 years at this point, but almost 9 years.
Wow.
But what we're finding is we need to become more specialized. We need to have better training for our teams so that they can do a better job with people. So a nice visit is a nice visit. But if somebody is trained in psychiatric care and can understand what's going on and what these folks might be experiencing and why they're acting the way they are and how they might be reacting, then we can be more responsive to them physically and emotionally, really, with the person. And also we can be more helpful with maneuvering the animal in. I work with a woman who has mental illness and it lives in a group home. And we don't just pet the dog. I mean, I bring out a journal and she writes in the journal and she picks up the brush and starts doing that. When I first visited her, it was pretty much like, I want my cigarette in 10 minutes, and she was done. And now I've got her for an hour and 10 minutes, and we're doing more things because we're engaging it. But it's all through the dog. It's all, let's hide biscuits for Sonny in the room, or would you like to get him water? Now she initiates that kind of thing. So the more we understand the people that we're visiting, the better we can do a better visit and give them more of the support that they need. And help the site, because the staff needs help in dealing with lots of people. And when we come in, people, I think, are generally more cooperative, they're less combative, there you go. Yeah. There you go. See, you feel better, you smile.
I smiled when I saw him come
I have to tell you, there was a lady in the lobby while I was waiting for them to come, and she looked very sad. I said, are you sad? And she said, yeah, and told me a story. And I said, in 3 seconds, I'm going to make you happy. And Krista and Tucker went, and she just beamed, absolutely beamed. It turns out this person works at AI DuPont, and she has seen the dogs there with the kids, so she's seen the kids' response. But she was able to have the response of making herself feel better this morning, right out there in the lobby. So anywhere.
Always on the job.
PAWS is anywhere.
So now we got the wagon walk, right?
We do. It's our biggest fundraiser of the year. It is October 19th at Glasgow Park in Newark. We kick off the day with a 5K run. Starts at 9 a.m. We also have a 5K walk. We are one of the only races in Delaware where you can run with your dog. You don't have to have a dog, but if you do, we're more than welcome to bring them along. If you're not into the 5K, we also have a 1-mile family-friendly dog walk that kicks off at 11:30. We have several other activities throughout the day. You can come. We have vendors. We have music. We have food. And it's just a great family outing.
My dog wanted a little stroller to get into. Like, really?
Yeah, people come.
We do.